Hello class! Welcome to Dr. Creel's online class. So, kumusta na kayong lahat? Hello my dear students! How are you? Okay, and for today, our topic is really that interesting and sometimes it's difficult for me to pronounce. It's hiatal hernia. Okay, we will be discussing its description, types, risk factors, diagnostics, and management. Okay, so this video is intended to nursing students and to anybody who wants to learn something about hiatal hernia. Okay, so the content of the topic was taken from a series of different authors of MS books, and of course the pictures were some taken from the Google. Okay, so set back, relax, and learn from the discussion. And syempre, if you find it informative, do like, share, and subscribe to my class. And please hit the notification bell so that you will be updated for the upcoming discussions. Okay, so start na tayo. So ito na nga siya. Okay, so this is what we called hiatal hernia. Okay, and in here, the opening in the diaphragm through which the esophagus passes becomes enlarged. So see this one, okay, becomes enlarged, and part of the upper stomach moves up, okay, into the lower portion of the thorax. Ayan, lagpas siya. So, based on this picture, this is the normal one. See, yung esophagus natin. And this is the diaphragm. Okay, hindi naman siya lumalabas yung part of the stomach natin. But, two patients that experiencing hiatal hernia, it depends for kung anong type meron siya. If it is sliding or paraesophageal hiatal hernia. Okay? So, ito na nga siya. When we say sliding or type 1. Okay? Sliding, this is type 1. Okay? So, it occurs when the stomach or when the when the upper stomachs and the gastroesophageal junction are displaced, okay, upward and slide in and out of the thorax. So, ayan siya. Okay? And according to the book, it is about 95% of patients with esophageal hiatal hernia have a sliding hernia. Okay? And dito naman sa ating second type, paraesophageal hernia are further classified as type 2, type 3, and type 4. Okay? Depending on the extent of the herniation. Why? Because when we say type 4, itong type 4 natin, this is the greatest herniation with other extra-abdominal viscera such as what? Yung ating colon. Okay? Yung spleen. Okay? At saka yung mga small bowel evidencing displacement into the chest along with the stomach. Okay? So, mas malaki yung nadi-displace, depende yung anong tawag nito? Type. Okay? If it is type 2, 3, or 4. So, ayun. So, let's have with the manifestations. Clinical manifestations and the sliding. One is reflux. Okay? Or yung heartburn. Okay, yun. Isa yun sa mga mararamdaman ni patient. Regurgitation and dysphagia. Okay? And in some other references is kasama si pyrosis. And but still many patients are asymptomatic dito sa ating type 1. And some patient may present with vague symptoms of intermittent epigastric pain. Okay? Or fullness after eating. Okay? So, ayun sa ating type 1 or sliding. With the type 2, there will be a sense of fullness or chest pain, reflux or regurgitation of ingested food, gurgling noises after eating, halitosis, regurgitation of sour materials in the mouth. Ayan. Our class. So, large hiatal hernia may lead to intolerance to food, and patient may experience nausea. Ano pa? Vomiting, of course. Magkakakarambal yan. Ayan, pag large, ha? Hiatal hernia. Ang hirap i-pronounce. And dagdag ko pa dito sa ating sliding hiatal hernia. This is commonly associated with GERD. Okay? Ayan. Pwede din minsan hemorrhage, obstruction, and strangulation. Okay? Can occur with any type of hernia. It can be sliding or paraesophageal. Okay? So, question class, if you have any question, just write it in the comment section and I will answer it later. Okay? So, move na tayo sa ating risk factors. Aray, this is more common in women. So, sa atin pala to common. Okay? Oh my God, sorry. Injury or other damage may weaken the muscle. Ano ba yan? By the way, class, I am currently experiencing cough. So, pasensya na. Obesity, aging, smoking, and putting too much pressure repeatedly, okay, on the muscle around your stomach, right? So, ano-ano ba yung pressure na pressure on the muscle around the stomach that is coughing, aray, no pa, vomiting, and straining during bowel movement. Ayan, kasi naman hindi agad ayaw agad pansinin yung urge, okay? Kaya ayan, tumitigas na siya doon kasi yung 10% ng water is na-absorb. Kaya nagkakaroon na ng straining during bowel movement and lifting heavy objects. Okay, yung mga pabayani dyan. Ako nang magbubuhat kahit sobrang bigat. Okay, pwede. Halang pangit ng sulat ko ngayon. Bakit kaya? Siguro nagugutom na ako. Ayan. So, ayun siya. Okay? So, huwag natin kalilimutan. My God, ang ingay ng aso sa labas. Pasensya na, sobra. Hindi ko siya mapipigilan. So, ayan, wag natin kalilimutan yung mukha ng normal. Sliding, ganito, meron siyang part lang na konti. Pero pag esophageal, depende sa laki. So, depende sa type. It can be 2, 3, and 4. Okay, so question. We'll go to the next one. Ayan, na tayo sa ating assessment and diagnostic test. Okay? So, X-ray studies, barium swallow, and fluoroscopy. Ay, parang kulang to. Meron pa tayong EGD. Diba? Natatandaan nyo ba? Natatandaan. Oh, ito yung pinakamahaba. EGD. Ano nga ito? Esophago, gastro, dito na lang sa baba, gastro, my God, duodenoscopy. Ayan, ulit, esophago, gastro, duodenoscopy. Sorry na. Okay, so in here, there will be a passage of a fiber optic tube through the mouth and throat into the digestive tract. Okay, this is for visualization of the esophagus, stomach, and small intestine. Okay, Meron pa tayong dalawa, I think. Yung esophageal manometry. Ba't nga ba wala siya dito na isali? Naalala ko lang. Manometry. At saka chest CT scan. Okay? So, dito sa ating management, one is determine an eating pattern. So, this may elevate the symptoms, of course. So, small frequent feeding that can pass through easily through the esophagus and elimination of those foods that aggravate the symptoms. Okay? Small but frequent feeding lang muna tayo. Okay? Paliit-liit. Yan. Patient is advised to sit up and not to recline for 1 hour after eating. Okay? That is to prevent reflux or movement of the hernia and to elevate the head of the bed on 4 to 8 inches blocks, okay, or 10 to 20 cm. That is to prevent the hernia from sliding upward. Ayan. And to avoid eating 3 hours before bedtime. So, ayan. Pag antok na, huwag nang kumain kasi it is 3 hours. Matagal-tagal din tayong mag-aantay. Okay? Next is, we need to teach the patient about the common prescribed medication and how they will take those prescribed drugs, okay? Kasi kadalasan naman yung prescribe dito ng doctor is yung mga H2 antagonist, okay? At yung, ano nga yung isa natin? Antacids, okay? So, ayan. So, ang responsibility natin as nurses ay we need to instruct the patient to take the medication on time with the proper dosage, okay? So, ayan. Etc. And teaching plan for client and family that includes we need to differentiate between the symptoms of hiatal hernia and those of MI kasi there are some symptoms na magkapareha siya. Okay? Sorry. And last, be alert to the possibility of aspiration. Okay? So, ayan, dapat talaga nating antayan. So, huwag nating kalilimutan itong advice natin sa patient to sit up and not to recline 1 hour after eating kasi there's a possibility na ma-aspirate sa patient. At syempre, pag kumakain is nakaupo. Alam na natin yon. Okay, so what else for the management? Ito na, surgery is hernia repair. Okay, so surgical hernia repair is indicated in patients who are symptomatic. Okay? Although the primary reason for the surgery is typically to relieve the GERD symptoms. Okay? Kasi meron mga GERD symptoms, kaya yun yung primary reason kung bakit nagkakaroon ng surgery, itong hernia repair. Okay? See, ito siya, tapos magiging ganito na yung mukha niya. Actually, there are current guidelines recommended a laparoscopic approach where there is an open transabdominal or what we call this transthoracic approach. Okay, this approach is reserved for patients with complications. Sorry, may ubo talaga ako. Complications such as bleeding, pero hindi to COVID negative naman. Dense adhesions and injury. Ayan, injury to the spleen. Okay? Yon. So actually, okay, tapos na yung surgery ni patient. So it is up to 50% of patient may experience early post-operative dysphagia. Okay? Therefore, tayong nurses, we need to advance the diet slowly from liquid to solids. Okay? While, mga tayo dito superhero tayo dito, while managing the nausea and vomiting And we need also to track the nutritional intake of the patient. And we need to monitor the weight of the patient. Ano pa? Madami pa tayong gagawin, nurses. We also monitor for post-operative belching, vomiting, gagging, abdominal distension of the patient, and epigastric chest pain. Why? Because it may indicate the need for surgical revision. Aray. Okay? And class, this should be reported immediately to the doctor, okay, or to the surgeon. Kasi, surgical repair is often reserved for patients with more extreme cases that involve gastric outlet obstruction or suspected gastric strangulation, okay, which may result in ischemia, necrosis, or perforation of the stomach. Okay? Ayan. So, kailangan na talaga yung ating clinical ay dapat observe talaga natin sa patient. Kahit hindi nasasabi ni patient na nasusuka ako, nakikita talaga natin yan sa mukha ni patient. Okay? Na nasusuka siya or merong abdominal distension, nakita talaga natin yan. Kasi syempre, i-measure naman din natin yung stomach ng patient. Okay? At syempre, minsan sa patient magsasabi na may nararamdaman siyang epigastric chest pain. So, ayan. Those are emergency, yung mga emergency symptoms na makikita natin sa patient or mararamdaman ng patient, kailangan talaga natin siyang i-report immediately. Okay? So, ayun. Any question? Class? So, ayun. So, I think this is the last. Ayun na nga, last na nga siya. So, thank you for listening and be always attend our class. Kasi may sinasabi tayong be informed, be knowledgeable. Okay? And again, if you find this topic informative, do share, like, and subscribe to my class for you to be updated for the coming discussions. Madami pa tayong pag-uusapan. And if you have any comment, or if you have any suggestion, or you have any clarification, or sometimes kung naririnig nyo na hindi tama yung pagka-pronounce, ayan, magsabi lang. Kaya lahat naman ay napag-aaralan. And kung meron kayong topic na gusto nyong i-discuss natin, magsabi lang din. Mag-isulat lang sa ating comment section. And again, thank you for listening and bye-bye for now. See you next time.